So when people come and see you in the clinic, what's the main thing or main topics, questions that people have, or the main thing people are struggling with?
People know me as a women's health practitioner, and quite often it's more that people they know that they've got some kind of problem. They've been to see a doctor or a specialist, and it's borderline outside of that diseased state. So there's no kind of treatment plan in Western medicine, but they're still experiencing symptoms that are still obviously really upsetting for them. And so that's when they will come and see me. They just want answers.
So been to the doctor, got some medication for whatever.
Or maybe no medication.
Okay.
Maybe they, there's a lot of talk around I've got my hormones are out of balance. And so they go see a doctor. One, they're told that hormones can't be out of balance, which I guess is technically true, but the way that people experience it feels like they're not, that feedback system isn't what it should be. And so that's how they describe it. And so they will ask for tests. Quite often doctors don't test at the specific times that hormones need to be tested for women because women's hormones fluctuate. There's 2 specific times where we can have context in where those hormone levels should be. And if they're tested outside of that, the context is taken away, and so you don't know specifically if those hormones are really where they should be at. Does that make sense?
It does.
Yeah.
So when should they get tested?
So usually day 2 of the cycle, so day 1 is the first day of full bleeding of a period, but a cycle is day 1 until the next day 1. So a period length might be 4 to 5 days, but a cycle, people usually talk about a 28-day cycle, which is the general average that people cycle. And so day 2, when you bleed, all your hormone levels drop to a baseline, and day 2 is the day that should be tested for that baseline level.
Right.
Yeah.
Okay. So again, if any women out there want to get tested for anything, that's when they should be getting their blood test done.
Yes, day 2 or 3.
Okay.
Yeah.
Right.
Anything outside of that, the levels start to rise, and so we don't know, it then starts outside of that window of context. And then any other time, because the estrogen will peak and then drop and then peak again within that 28 days. Also, outside of that one, then there's a mid-luteal phase. So usually people would talk about that as the day 21 test. But day 21 is 7 days post-ovulation, and ovulation can happen, depending on when a woman ovulates. So we would call it a mid-luteal is from ovulation until the next period. That's that phase there. And it's 14 days, but the 14 days starts after they've ovulated. So trying to identify when people ovulate and then trying to guesstimate what 7 days would be post then, and then getting another test. Yeah. And so that's when, people, I explain this to them, and then we would usually peel it back and be like, okay, what is a cycle? What are signs around ovulation? Let's understand that first, and then we will kind of go from there. Yeah. So collecting data is really important for women at any age so that they can understand what is specific to their body. Because we talk about a day 28 cycle, but I think it's like 27% of people would ovulate on day 14 or something.
Yeah, right.
So identifying, and that is especially specific to someone in fertility, because you're wanting to get that timing right around ovulation to know when to have sex at the right time so that the egg and the sperm can meet. So, yeah. A lot of it is sex education, actually, now that we're talking about that.
Well, Dr. Suzi, thanks for coming on the podcast, helping people create babies.
Yeah.
How about you tell everybody who you are and what you do?
Oh, yeah, sure. So my name's Suzi. I am a doctor of Chinese medicine with a master's in reproductive medicine from a Western medicine perspective. So went to the university for 5 years at RMIT and studied a combination of biomedical science and Chinese medicine, and then practiced in the kind of IVF realm for a couple of years. Just lucky that I landed a job in a clinic that was attached to an IVF clinic, and that was when research was emerging around how Chinese medicine could potentially help and support and increase IVF rates. But then with some of this information I was giving people, like getting your hormones tested on day 2, and GPs weren't giving that same advice, I was really confused about what the medical system were telling people. And so that's why I went and did my master's and found out. And then all of my colleagues were other GPs or gynecologists. And I was like, these are the people I was referring my patients to, thinking you would know. But now we're all in the same class now for our masters. And so just understanding, you know, it's such a challenging job for a GP to be all over everything. So, if someone's got a special interest, then they will know. But outside of that, general information doesn't give them that kind of detail that they need to pass on to their patients.
And like you were just saying, like especially with women's health, it's so complicated. It's so individual.
Yeah.
There's so much to unpack. But let's dive into sex.
Sure.
People think just having sex equals babies.
Yeah.
It's not that simple, is it?
No. There is a specific time that people can fall pregnant. And I guess this, you know, if we're talking about sex education, most of us just learnt that abstinence is everything. Avoid, trying to get pregnant at any time. And look, the reason that there is an increased rate, you know, in, I guess, teenage pregnancies is because sperm and eggs are the most healthy that they would be at the time. And we know that sperm can last 5-7 days in the female body. And so no matter where they're ovulating, if that sperm's lasted longer, then it feels like you can get pregnant at any time. But as we age, there is, you know, I guess lifestyle factors and certain things in the body that can affect the quality of both egg and sperm. And so that's when timing needs to be more important. And understanding what that time is specific, as you said, individually for the female. And so there are signs for ovulation, which is usually a slight increase in cervical mucus, or maybe day 10-ish. Let's base it on a 28-day cycle. Not everyone gets those signs. Not everyone gets it as much as other women. And so I guess it's just really kind of trying to be in tune with that. But if you are trying to have sex and fall pregnant, having sex before you think you ovulate is more important than trying to work out when you ovulate and then have sex and try and catch it. Because once an egg follicle pops out of the ovary, you've only got maybe 12 hours, 24 max.
Yeah, right.
Yeah, and then the egg is no longer, like, if it hasn't fertilized, then it will just,
And then try again next month.
And then it's a whole month, yes. Yeah, so, but if we know that sperm lasts longer in the body, having sex before you ovulate so the sperm is there to meet the egg.
Okay, so let's just say somebody's been trying that for a couple of months now, or how long should they be trying that before they start, I guess, saying, hey, something's not working, what should I do?
So the guidelines will say trying for 12 months is a reasonable amount of times. But if we put that into context, it's 12 times.
Yeah.
If they're not sure about the timing, or if they, you know, most people are just kind of having sex whenever, and then we'll do a bit of Googling, work out that they need to work out a timing. And so we need to take that into context as well. So maybe 12 months. Research shows within 6 months, if everything is as healthy as it can be, someone should fall pregnant within that time. And then the stats drop a little bit with falling pregnant within that second 6 month part of the 12-month cycle. But, you know, I mean, there's so many factors that can come into play there as well. So, timing is the most important. Age, again, is really important. Anyone below 30, that's reasonable. Anyone sort of around 30 or above within 6 months, and then maybe it would be worthy to just make sure that everything is checking out.
So when I had you coming on, I obviously put it out to the community and got a few topics or questions and that sort of thing that people want to talk about. And it's usually the typical guy thing. It's like, should guys be waiting and only like ejaculating when we're trying for a baby in that like in that period where like his partner's fertile, or does it matter?
Yeah, it matters.
Okay.
Sperm has a 3-month cycle. So unlike women that have eggs in their ovaries, and it's kind of like a tissue in their ovary, and then the hormones make little follicles develop from that tissue, and then the eggs pop out. So it's not like caviar where we have all the eggs in the ovary. There's a bit of a process. But with men, there is this constant generation of sperm, and that takes 3 months. So sperm will develop and sit in the testicle, and then 2 weeks within that, it moves into a holding bay for then where it's going to ejaculate from. But in that 2-week cycle, they become their most sensitive, and so they're extremely sensitive to heat, to damage if someone was doing, rigorous exercise or what have you. And so there can be debris of sperm within healthy sperm as well. So usually we would call it cleaning the pipes, maybe ejaculate a week before. But the best kind of sperm is kind of that 4 days before you're wanting to start trying for fertility. So, yeah. And
then I guess we're talking about eggs and sperm. Mm-hmm. Obviously, lifestyle comes in that as well.
Huge. Yeah.
Sorry.
I was going to say, and the statistics show now, because a lot of the weight of supporting fertility was heavily weighed on the female, but now it is 30% male factor, 30% female factor, and then 30% of a combination, or 33%. Yeah.
Yeah. And because I see that all the time, like people, again, we know that, sleep, nutrition, exercise, all that sort of stuff comes into being a healthy person. But the way I sort of try and put it is, the healthier you got more vitality, which equals, a better sex drive or better opportunity to produce. Because again, that's what we're animals at the end of the day.
Yeah.
And we're here to reproduce. We just, I guess, got a bigger brain than most animals and can think a bit differently.
Yes.
So, but I guess on a biological level, that's what we're here to do, like reproduce.
Yeah, yeah.
So what are the biggest misconceptions when it comes to, I guess, supplementation or lifestyle? Like, what are people getting wrong with that?
I think men don't always assume that they're going to be the problem. And if they're, things that can really damage the sperm, like a lot of heat, a lot of radiation, and these are all emerging factors, and not just within developing countries, but developed countries, but developing as well. So there is this worldwide recognition that sperm quality is changing. And if you look at the WHO recommendations for sperm quality, even in 2010 compared to now, it has the reference ranges in the lowest point that men can they assume would fertilize an egg have dropped to try and, I guess, capture that. Yeah.
Yeah, it's scary, isn't it?
It is. It's challenging.
Yeah. As a species, men, we're getting worse and worse at...
Less fertile. Yeah. And so, there's a lot of research into trying to really significantly understand how and why that is happening. We can only assume that lifestyle is a massive part of that.
Yeah, of course.
So stress, heat, radiation are the biggest factors.
Yeah, heat's a big one.
Heat is a big one.
Yeah, it's it's one of those things, I don't know where I learned it, but I learned it quite young that, making sure that you don't overheat your testicles, like wearing loose underwear, all that sort of stuff. Obviously heat exposure, being mindful of that as well. But it's just something that guys just don't even think of.
No.
And it's so simple.
Yeah, just ice your balls.
Yeah.
And you can get, there's underwear out there as well. I can't remember the name of it. Cool balls underwear. So I guess there's a pocket where the testicles can sit in so that it minimises being next to the body for that heat. But even just, putting a bag of ice and just icing them to try and cool them down during the day is important.
Don't know if it's too much information, but for the guys out there, I like to finish my shower with cold water on my junk.
Perfect.
Yeah.
Absolutely. Even, if you're going to have a sauna, ice them.
Yeah.
Because saunas are if you're trying to fall pregnant, just avoiding all of that heat exposure. Riding a bike as well, from, potential risk of damage, which again creates debris. But then other factors as well, alcohol, smoking are the biggest things that damage the DNA within the sperm. And so the other aspect is, while we can look at the sperm from a sperm analysis and have a look at how it looks, that doesn't necessarily give us a picture of the DNA within the sperm. So you can do additional tests like a DNA fragmentation test, which again, when I was talking about that holding bay for the 2 weeks before it ejaculates, is where DNA can become damaged as well. And so if people want to do additional tests or really understand just the quality of their sperm, not just by looking at it, but also the way that it would function, a DNA fragmentation test can be really useful.
Can the sperm get healthy over time for males?
3 months. Yeah.
So just in that so if a guy went from smoking and drinking and then just stopped that within the next 3 months, it should be a lot better.
You should see a change. Yeah.
Yeah, right.
Yeah. And so it's also generally so much easier to treat a male. And I think from Western medicine, because people often ask how, so maybe that information isn't yet passed on within the literature and all the rest of it. But usually what we see is, lots of high antioxidants, maybe some zinc and selenium, and looking at other certain supplements that they could potentially take. Now, there's also, supplementation is challenging because not every supplement is created the same. And there are different types of molecular size of a substance that will be able to react within the body and get, be absorbed in different places, which will depend on how that can influence what we're trying to implement. So there's different types of zinc, different ways that zinc is then metabolized and absorbed into the body. And so that is when looking at a health professional is really important, who understands supplements, to then know what they should be taking, the correct dose, because, you don't want to be taking a supplement thinking that you're doing amazing things for your sperm and finding out that it's the wrong kind of supplement and you're 3 or 6 or 12 months down the track and nothing is changing.
Yeah, I shared a study the other day about heavy metals in all the supplements now, especially when it comes to micronutrients and all that sort of stuff.
Yeah.
People think they're taking all these good magnesiums, all that sort of stuff, but the heavy metals, even with all the new ones coming out, I don't know if you call them new ones, but popular ones, ashwagandha, tonka ali, all that sort of stuff.
Yeah.
They're saying the heavy metal, it's a big risk, especially if you're getting it from a pretty bad source.
Yeah.
So you're taking all these things, thinking that it's going to improve this, but it's just like, if you've got a big issue with heavy metals, then it's just going to affect so much more. So supplements are just there to supplement the diet.
That's
not to rely
right.
on.
Not to replace.
Yeah.
But understanding what it is. I also have patients that come in and they've got a multitude of supplements, don't necessarily know why they're taking them, or have thought, oh yes, this could be right. They might be conflicting, or they might be the wrong type, or they just, there's something we call bioavailability. So when you put a tablet into your mouth, the way that it breaks down, and there'll be cofactors within that supplement that help your body absorb it, and then there will be excipients that need to be excreted. But if they're higher in excipients and lower in the actual active ingredient, you're not necessarily absorbing as much as you're getting in terms of dosage too. So this is where practitioner-only supplements, or talking to a practitioner to really be specific. They are more expensive, but they're more expensive for a reason.
Yeah.
And so cheap, just be mindful.
I reckon
Grabbing something from a supermarket or a chemist.
I always say to my clients, do not get supplements from a supermarket.
No.
It's not worth it.
Yeah.
You're probably just wasting money because it's going to come out your body eventually, or it's just causing all sorts of health issues that you're not even seeing.
Yeah. That's right.
You get what you pay for.
Yes. And look, if that, the caveat to that is as well, you purchase something that is, I guess, what you can afford, understanding the repercussions of it. So if it's the cheapest thing, or you can only have one supplement, then talking to someone about what that one supplement would be. And if it's too cheap, maybe it's worth even keeping out rather than putting in.
Yeah, definitely.
Yeah.
All right. So men's health, I feel like it's covered. Men just be a bit healthier and your sperm should increase.
Keep them cool. Yeah.
Keep them cool. Women's health. I know you're specialising in menopause at the moment, but obviously what you do before menopause in your 20s, 30s, 40s matter as well.
Yeah.
So what are people overlooking in those younger years that are going to affect menopause?
That's challenging, because I guess that is still emerging as well, in terms of, we see it's reasonable that looking at what a mum or a grandma kind of went through in their menopausal change might be similar, but we also know that for some people it's a completely different experience. From a Chinese medicine perspective, quite often we can see, if someone has suffered from different diseases like PCOS or endometriosis, that might have an effect on menopause. But I guess it's around that kind of 35 to 40 years where hormones will start to change, and it really comes down to symptoms. Because what I'm also mindful of is we don't want to pathologize menopause. Every woman is going to go through menopause, which is one day of all of a sudden you won't have had your period for 12 months, and that is menopause, and then you're postmenopausal. So it's literally just that day where you haven't had a period for 12 months. And everybody is going to go through that at some point. That might be premature menopause and be earlier, or some women will still have their period up to, kind of 55, and then it will start to change. But understanding what the risk factors are, I think between 35 and 40 is really when people should start to be aware of potentially what their postmenopausal journey might look like.
And what are those risk factors?
So what I mean by that is things like cardiovascular disease, osteoporosis risk, even dementia, which is a challenging position to be in as well, because they're still trying to acknowledge where dementia comes from. But they also know that women in particular, and postmenopausal women, have a much higher risk of developing these risk factors once they've gone through menopause. And so, yeah, it's a hard one to really kind of understand. But there's so much more awareness now around what can be supportive in menopausal changes, both from lifestyle factors and also now with this emerging change in what used to be called HRT, hormonal replacement therapy, which is now called menopausal hormone therapy, MHT.
Can you just dive into that a little bit more? Because obviously me and I know about HRT in the, as guys are getting older, it's getting more popular for guys to go on testosterone, all that sort of stuff. What does that look from a female's perspective?
It has definitely changed. So there was a huge study put out by and the name has just escaped me, back in 2002, where there were 4 arms to this study, and they had looked at hormone therapy, but the hormone therapy that they looked at was a different kind of estrogen that acted differently within the body. There were the way that they had, initiated women in different circumstances. So postmenopausal, usually, I think they were all around over 60. There was, a lot of factors.
Yep.
And so the study then had to halt because there was this misinterpretation on the study about how estrogen affected females, understanding that it was a different kind of estrogen to what doctors are looking at now, and also a different population group to what they're looking at now. And so now all of this new study is emerging. They're re-looking at what that data showed, and I guess, using that to put into context how different that was compared to how they're treating people now. So they're using a more, what they call bioidentical estrogen, which means it looks similar to our estrogen that we create in our body. Different ways that they would apply it, so using a gel or a patch as opposed to a pill, which they ingest. But certainly, these are things that people need to talk to their GPs about, and more specifically GPs that I guess have a special interest in menopausal therapy, because it is still emerging, and as we spoke about before with GPs, just, being so challenging, being across everything, you're not going to get necessarily the same advice if they haven't come across that research yet. So, yeah.
Yeah, there's a lot of information out there.
There is so much, yeah.
It always comes up about hormone balance, like whether, it's a 16-year-old going through puberty or, somebody going through menopause or a male thinking about testosterone replacement, hormone balance always comes up. Like, what should people be thinking about when it comes to hormones? Like, is that even the right word? Like, can you balance your hormones?
Well, I guess technically it's not balancing. It's just now it's a way that women describe how they feel, basically, where they feel like their hormones are out of balance because all of a sudden they're getting these different symptoms at specific times of the month that feel far more excessive than they normally would. And so, I understand that there is, especially in the medical field, Western medical field, they will say your hormones can't be out of balance. That's kind of true, but when we're talking about it in the context of women feeling these really erratic shifts within their hormones, then it feels like they're not balanced.
Yeah, something's out of whack.
Yeah. And they will feel off. So it's almost a physical thing as opposed to this physiological change. But again, this comes down to, symptoms as well. So hormones will fluctuate according to what your body is telling it to do. And what I mean by that is we've got, two states of being. One is that stress response, fight or flight, and there are hormones, our stress hormones, that will always take priority over our fertility hormones and digestion hormones. And so generally, if things are starting to sway, we need to look at which system your body, or you're telling your body you're in, which is reacting to which hormones need to be more prominent. So
I'm glad you said it like that, because a lot of people just think when they hear hormones, it's just like estrogen and testosterone and that's it.
Yeah.
But there is so much more within your body to do with hormones.
Hormones are just little messages that get sent. And, even when we're talking about sex hormones, they are signaled from the brain. And the brain has to switch on to say, yes, release these hormones, and then those hormones travel down to your sex organs, and then that cycle comes from there. So, but hormones are everywhere. Digestion, stress hormones, we talk about cortisol, but I don't know if people necessarily put cortisol hormone and sex hormones in the same bag. You are so right.
Yeah. But it just goes to show that everything you do is going to affect your hormones. So stress, sleep, food, alcohol, all that sort of stuff. So it's all different things, I guess, you're doing to your body that can affect your hormones, but you can go the other way as well. Like I see that all the time when people overtrain, overstress the body in a thing that they think is good for them, but they're overtraining and then they lose their period or something like that. So it can go both ways.
Absolutely. Yeah. Yeah.
So when it comes to things like, I guess, period-based pains, mood fluctuations, all that sort of stuff, is that normal, or can that be, again, balanced out? I hate using that word, but that's, again, it just keeps coming up with the questions and all that sort of stuff I get from the community.
Well, it's how women feel. It's their descriptive term.
Yeah.
Yeah. Yes, they can. What was the question?
Mitigate, I guess, pain. Like, let's touch on period pain. Like, is that normal? Can people fix, like...
It's common and I think has become normalised, but it's not normal. We shouldn't be experiencing pain every month. Now, you might get, certain twinges, and there might be a tolerance level that people experience with that. So again, we're looking at quality of life and the symptoms that are coming up and how much it is affecting that person. So if someone, is having debilitating period pain, that is not normal. But I guess, people kind of feel like they've certainly been told that it's just normal and just to push through. But there are certainly things that can be done to help support that so that they can feel more balanced and not ruled by their period. Or their cycle. So even outside of their period, the week before, a lot of people can feel incredibly kind of out of whack. Their moods will fluctuate quite significantly. Their tolerance level for people and things becomes really low. And there are medical conditions around that, like PMDD, which is a really severe state of PMS where they become, incredibly suicidal. Their whole persona can change. Their whole mental state can significantly change. And this is where we need to move from what is normal and what is kind of, I guess, you're able to live with versus, really significant factors that, if they become dangerous, need to be assessed and really looked at. And so talking to medical professionals, if people are really feeling these big, strong shifts, I think do really need to talk to the Western medicine community as well.
How would somebody... Unfortunately, I'd say there's a lot of females out there that just feel that as normal and that's just happening to them and they've just got to deal with it. But how would they identify that it's not normal, and what should they do then?
I guess, there's been a lot of gaslighting in the past. And so...
What do you mean?
People are told when there's significant pain that it is normal, and it's not normal. So when people know that it's not normal, or when it starts to impact things like you're missing work, you're missing school, you're having to take really heavy medication, pain relief medications and things like that, and it's starting to really, if it becomes debilitating. But even up to that point, if it's really strong and you're taking days off work or, functioning for a particular amount of day, then,
I think it comes back to that unbalance. Like, it doesn't have to be sort of within your body. Like, if your external life's not feeling balanced, it's all sort of coming into your overall health and wellness. Not necessarily your hormones, but if your life is feeling unbalanced, there's obviously something going on. Good way to identify it and talk to somebody about it.
Yeah, absolutely. And there are quite a few, it might be talking to a psychologist and finding different kinds of tools and management techniques that can support at that time. This is where I think I was mentioning data is really important. Data collection is really important, and people really understanding what their cycles are. Because even if they know that there is a shift that's going to change, reducing potentially their physical activity or their social interactions with people so that they can just concentrate on themselves rather than trying to manage external factors as well as what is happening with their body can be helpful. But that's when, and people have different ways that they want to manage that. Yes, there's medications that people can talk to their GP about. And then there's natural ways that people can kind of, have a look. That's when acupuncture and Chinese medicine can become really effective. Different supplements, talking to a naturopath as well, because we know that there are supplements that have a significant influence on that feedback system of hormones as well. So it doesn't have to be medicated per se, but it can certainly be something that if you talk to a health professional about, can potentially and really significantly have a change in the way that people are experiencing those symptoms.
You said collecting data. What does that look like? So I know there's a lot of period tracking apps out there, blood work, like
all of that. Yeah. So I think just from a really foundational level is, monitoring things like mood, pain, digestive changes, even things like cravings, sweet cravings or salt cravings at certain times of the month, and really having a look at what that looks like for you in a whole cycle. And from there, when you take that data over a month to professionals, they can kind of have a look as well as to potentially what hormones might be impacting the individual at certain times of the month, and then going from there to really be specific on the types of treatments that could really help them. And that's when personalised care comes in. But if you've got data for that, then it can relate to the person as opposed to a general, this can change, in your follicular phase, which is day 1 to ovulation, or we'll give you this for luteal phase, but not necessarily. It just becomes a bit more specific if people can collect data. Other ways they can do that are temperature tracking, and a lot of people can use that, especially when there's 2 ways. If people are trying to fall pregnant, then they can use temperature tracking, but also if people are wanting to avoid falling pregnant and using that method to, avoid when their fertile window is.
How would you know with the temperature?
So you have to take your temperature first thing every morning. Everything has to be consistent. So if you wake up at 6 a.m, it has to be 6 a.m. every morning. If you're, wanting to sleep in on the weekends, set an alarm, take the temperature, and then go back to sleep. So it does need to be very consistent. You do need a regular cycle as well. So for someone that has something like PCOS, which is quite common to have an irregular cycle, it can be really challenging because that fertile window will change, and that's where there's other ways that you can track and other tools that are now on the market to help for that. But basically with temperature, so what we see is a general baseline between day 1, which is the first day of your period, up until ovulation. We coincide that with cervical mucus change, and then around 2 days later you'll see a shift in the temperature, and then it should remain about 0.4 of an increase average from post-ovulation to next day 1. And then day 1, or say 28-day cycle, day 28 it will drop, and then they will receive, they should start their period.
So if you want to get pregnant, when you start warming up, that's when you want to have sex, and if you don't have sex then.
Until the temperature shifts. Yeah.
Okay.
So if we use this data then in terms of how to fall pregnant, the fertile window, if we keep in mind that sperm lasts about 5 days, so you probably want to, and data needs, anything with fertility we only know after the fact. So if your data then becomes really consistent, it would be reasonable to assume you'll find this fertile window. If you've got a 28-day cycle, maybe you sometimes get a 26-day cycle, sometimes it's a 32-day cycle, then that window will come a little bit larger because we only know when you ovulate after you've ovulated. So if they're using this method to avoid falling pregnant, they need to wait until that temperature shift has shifted before they then have unprotected sex. But if you're trying to fall pregnant, then starting usually day 8 if you've got a 26-ish day cycle, maybe day 10 if you've got a 28-day cycle, just to cover sperm there to be able to meet the egg being released, and then that temperature shift happening.
Okay.
Yeah. it's complicated.
It is. And let's talk about the pill. So if you're on the pill, all that doesn't matter? Like, should you still be tracking, getting data, all that sort of stuff?
So the pill is what kind of puts you into a post-ovulation state. So the pill has a hormone called progesterone in it, and that prevents you from ovulating. There are, and people, if they're on taking this medication, do need to really look at, the other factors that can prevent it from not working all that well. For example, if someone's taking antibiotics, then it can have a change in the way that the pill operates as well. So, but in general, if they're taking it, what it should do is really prevent them from ovulating. And ovulation is the main event. I know we talk about the period, but the period is only what happens if you haven't ovulated. We've got to bring it back to ovulation. So the pill just puts you into that to prevent you from ovulating. When you stop taking the pill, which is the progesterone, usually an estrogen progesterone, depends what type of pill they're taking, but the progesterone, when you remove that from your body, signals that you're not pregnant, and that's when a period will start. Mm-hmm. So if you're, some people do track because they want to see what is happening in their body, but that also can be why people feel these changes in their body compared to, if they were having a regular cycle in that luteal phase just before their period, where they can get a bit more irritable, they might feel like they're putting on a bit more weight because it's that component there that they're maintaining in their body.
I'm not a big fan of the pill. Obviously, I'm a male, so I can't really have much of a say in it. But it just seems like it's a bad idea to, in certain circumstances, to, I guess, block that for, 20 or 30 years. Because a lot of young females just go on it because they don't want to have a period and then stay on it for a long time. Is there any risk factors in that?
Again, that's when looking at the research on the data sheet that people, when they're taking the pill, need to be aware of. The pill for me is quite significant in terms of it did give women back the control of, if they were having unprotected sex and really, preventing pregnancies. I think it was a really important shift that happened when it was released. It can also certainly have a significant impact on women that are experiencing these changes, and it prevents them from feeling those fluctuations until they're ready. For me, because I often see women that are coming in after they have had, difficulty in getting their period back after the pill, but there's also an incredibly large population that have taken the pill for 30 years, stop it, fall pregnant, no issues, it is suitable for their body. It does have a protective factor if it does have estrogen in it, because someone like PCOS, where they don't have that turnover in estrogen and progesterone, which is really protective for the endometrial lining, can cause complications. And so that's where it can actually be really helpful and really supportive for people that need that change. They actually don't even need to have that withdrawal bleed necessarily. They don't have to stop that every month. That was something that I think when the pill was developed, men decided to keep it more normalized, that take the sugar pills so it feels like you're having a period. But if you're forcing a 28-day period and your body isn't ready for that, you're also forcing a bleed. And I guess the other side of it that we don't talk about, and it's a really big factor in Chinese medicine, is how much fluid you're losing compared to how much you're replacing in your body. And so when you're talking about women that have significant period issues like endometriosis or just really heavy bleeding every month, even if people are coming into menopause and their hormonal shifts start to change, and so they might have had a light period forever and then all of a sudden they get these really heavy bleeds. In Chinese medicine, we look at the blood being a substance in the body that helps with moistening and with cooling. And so often we see these symptoms coincide with, if they've had a really heavy bleed, they might get really hot at night, or they might start to get quite sweaty. And it looks like these menopausal changes, but it's also just the way that the body is trying to cope with kind of losing this fluid. And so if someone is having these issues and they want to take medication for it and it prevents them having these really significant bleeds, then it can be really helpful. Yeah. So for me, it comes down to, and the reason that, I guess we have to be all over this information on what people are doing from a Western medicine component is not because we want to feel that women are shamed into taking medication or feeling like they have to do it a natural way. There are alternatives, and I guess it comes back to understanding what they're doing with their body, what the risk factors are, what the reason that they're taking it, and then putting all of that information together and working out if it feels right for them.
Almost sounds like it just comes back to the supplements as well. Don't just take something because everybody else is doing it.
Absolutely.
Like, get some proper advice for you and your body.
That's exactly right. Why are you taking it? Is the dosage right for you? And this is where other blood tests and things, become really important as well. So I do tend to send away analysis for people depending on what their general bloods are like, what their fertility hormones are like. Maybe we might do a hair analysis as well, which would tell, what I guess those excipients are in your hair. It can tell things like heavy metals, which you were talking about before, and having a look at what that overload might look like in your body. And then you can be really specific in what supplements you can take to kind of to reverse that or to increase if we need to. Things like vitamin D are really important, iron are really important, and regularly checking them if you know that you are or can be deficient in those. I tend not to prescribe a multivitamin so much because, one, it's not as specific with what we want to give people, and two, the dosages tend to be for a maintenance dose. And for me, if you're wanting to supplement, you're supplementing for a reason. And if not, then change your diet. Yeah. Fruit and vegetables, nothing is going to compare
to the real thing.
Yeah.
So I guess that was going to be my follow-up question. You sort of said that about heavy bleeds, and then are you replacing that? That just comes back to proper nutrition, eating the right foods?
It can be. Having a look at, we know if people are bleeding really heavily, then they tend to have an issue with maintaining iron levels in their body. And so looking at foods that are really rich in iron, there are Chinese medicine herbs that can really support that too. We have, if someone comes in to see me, because I do treat Chinese medicine, I'm not a Western medicine doctor, but we can prevent them from continuing to take or like needing infusions or their iron dropping too low if we do have a look at their diet, if we do use Chinese medicine herbs, and making sure that the body is absorbing as much as it is. Because the other factor too is if you're taking supplements and your digestive system isn't optimal and you're not absorbing, you're just going to excrete it and it's not going to be absorbed. And so this, again, is when it comes down to, if you're trying to get like this whole body experience and really wanting to understand what the root causes are and potentially ways that you can manage that from a preventative level, then seeing someone like Chinese Medicine Practitioner or a naturopath or a dietitian or someone that can really help with the main factors that have to be there before you start to build. And that would be digestion, sleep, they're the main ones, and exercise, movement and stress levels.
Yeah, of course.
Yeah.
We're touching on this before we recorded about how it's just like, Western, modern, this, that, and there's all these borders and lines. Can you just explain what Chinese medicine is? Because people will hear that and just go, what is that? Just herbs and roots?
So weird, yeah. Chinese medicine is a theory-based system on how the body talks to each other. So we are different systems and we're a multi-system machine, and no system in any machine goes into dysfunction in isolation. And so if you have issues with your digestive system, it's likely that it is then going to have an impact on the way that you're absorbing supplements. So it'll have an impact on your hormone levels from a fertility perspective. It can have an impact on your sleep. And so we look at connecting all of those systems together and then trying to understand what is out of or what is in dysfunction, and then trying to optimize that so that all the systems can start working collectively together. The way that we do that is looking at different signs and symptoms. So it's really a pattern recognition. And you might, we'll work with digestion. So digestion, people might have something, they'll eat something. Sometimes it might elicit a response of being really hot. And people, chili is a great example of that. It can make you really sweaty. It can also either make someone constipated or they might have diarrhea from it. And so then we would follow that pattern. If it's diarrhea, what else is happening? If it's constipation, maybe what's happening there. So it's, again, individualized in the way that you respond to a certain thing coming in. We're not treating the digestive system per se. Yeah, so it becomes very individualized, and I think this is why it is hard to really get any kind of, papers from it, because we're not replicating the treatment according to the disease. We're replicating the treatment according to the person. Yeah.
Yeah. And look, there's definitely, I guess, modern medicine is definitely needed. It's very helpful, does all these things, but people, I think, just put too much weight on that exact thing. Like, this medication does this and that's the outcome. Like, how about we look at, everything else that's going on? And I guess that's the thing of Chinese medicine and blending it with the modern medicine. Instead of just saying, here's the research, here's what you do, that's what you get. Let's look at the whole body and see what's going on.
And people don't have to pick. You don't have to pick a side.
No.
There shouldn't be sides.
No.
We were talking about this earlier. You might have a medication that is really helping support a significant symptom that you're having. You might have other symptoms too. And so, again, working with a practitioner that understands different interactions, and, how we can try and make it so that your quality of life, at the end of the day, that's the outcome that we're looking for, is as optimal as you either want it or are prepared to work towards. And so, I guess the reason that Chinese medicine practitioners will talk about this Western side of things is because we have to be all over it so that we understand the way that we treat isn't going to conflict or have a significant impact on what the Western medicine side is doing. Yeah. And that was where I found my master's came in. It was significantly helpful in understanding all of these contraceptive medications, the way that the body really innately works within fertility and stress, and just understanding that from a Western medicine perspective, understanding that there is limitations with any research that comes,
Let's move on to menopause.
Yeah.
What's some big misconceptions to do with menopause?
I think first of all, the biggest misconception is the one due to this paper that came out in 2002 with, menopausal hormonal therapies causing cancer. And I think the emerging research coming through is that it could potentially be protective against certain cancers, not reactive. And that, I do have women come in and see me from a Chinese medicine perspective, and there are so many things that we can look at in terms of, I think now the list for menopausal symptoms is like 80 different types of concerns that they can relate back to menopause. So not that we want to pathologize menopause, but understanding that if people are finding it's really significantly impacting their quality of life, there are things that they can do to support that. So oftentimes people will talk about brain fog or increased anxiety, insomnia, and there are certain medications that people can certainly take for that as well. Other women don't want to take medications, and so they're trying to do, the more, I guess, natural approach. And oftentimes that will work, but it is hard work and it is consistent, and they really need to be on top of it. And quite often, we'll refer them to a GP, they'll start hormonal therapy, and the significant proportion of those symptoms will start to dissipate. And so, I guess the misconception that it was a really scary and really significant medication is now, it can be significantly helpful. Yeah. And protective for as long as possible. And the research, especially when I was going through the masters even 5 years ago, was suggesting that people needed to not take hormone therapy for up to 10 years, but now the research is changing around that as well. So really encouraging people to talk to menopausal GPs that can really explain that to them. But I do also get people that still come in and have other symptoms, or they might just have, minimal symptoms, like they're just getting hot flushes and they don't want to take hormonal therapy, and understanding what those options are. So then we would go through things like what lifestyle factors will have an impact on these hot flushes. It might be food, it might be sleep, it might be different kinds of activity that they're doing. And then again, that's about collecting that data, understanding what those factors are that have an influence, and then they can then work out for themselves. It becomes a choice then. And so it doesn't have to be, you don't have to have medication. It could be potentially extremely helpful, extremely protective, but there are just now other ways that people can really understand the impact that menopause is having, and going from there.
I'll read out this question, just to transition us into exercise. I know the answer because I dealt with this 100 times and got the right results. Weight gain during menopause is going to stay with me forever, or I can't get rid of it. True or false?
False. That is definitely false. At the time, it feels very, very true. And I think the hardest thing is, and the thing that I see time and time again, and that I experience for myself, is you will reach an age where all of a sudden everything that you did in order to maintain weight or lose weight changes. And so not eating food all of a sudden makes you feel like you're gaining weight instead of losing weight. High intensity cardio, which used to make you feel like you're losing weight, can now increase weight. And so everything about it is this shift into understanding what this new normal has to be, to come back to what is happening in my body and how I can support it from a change in age, because now the physiology has significantly changed in my body.
I couldn't agree more. And like you said, your body changes over time. So whether it's 20, 30, 40, 50, 60, it changes. And what you're doing in those times are going to have to change with it. But I've had many clients go through menopause and get great results afterwards. So that's a myth. It can be done.
It's hard though. It's a hard mindset shift, and especially when up till that point, you've had kind of, 20 years of understanding and kind of learning about your body between being a teenager and being 40. And then all of a sudden having to relearn that when, those neural pathways don't develop quite as fast as we were as a teenager. So all of these things is just all of a sudden like, oh my God, I have to start again. It's tough.
It is very tough. But there's a lot of information out there to help people. And again, I'd strongly recommend reaching out to people that have done it before, whether it's people that have been through this, like, similar journey, got those results, or seeking professionals?
Seeking people with similar journeys is an interesting one that, always comes from a beautiful space. Someone feels like they have found the secret and they want to share that secret. And that is, coming because they want to help. The other factor with that, though, is that their journey is their journey, and we can't always apply that to everybody. We need to come back to personalised care and understanding what that individual needs. So taking that with a grain of salt and trying not to, pitch bodies against each other or comparison, which is something that women do constantly, and understanding that that is just not how we can support ourselves if we're trying to compare somebody else's journey. And it's really challenging for anybody that has got their own story to not place that bias on the people that they're trying to support.
True, 100%. And that comes down to, we were speaking about this before, about trying to just cut through the BS. Like, there's so much information out there, and I guess people's stories just add to that information. Like, this person took this supplement to help them through this situation, and that supplement's the best and it works, so you've got to try it as well.
Yeah. It's and I think this is where all of that noise comes from, and people are like, there is so much information. You need to really identify where that information is coming from, and if it's coming from a personalized individual experience, or whether it's coming from, the research and a broader sense, and understanding the limitations, I think, for anything. It's hard, because even like me, I try and pull myself up on, I guess, things that I hold true to me, like that I think it will work for everybody, but I know they don't work for everybody, but then I tend to push that onto everybody. Yeah. It's hard. It's so hard.
It's hard.
And it's hard for the individual as well, when especially they've gone to see professionals and they're not getting the support, or they're not feeling heard, they're not, there's no direction, and so then they pivot to find anything that will help them, and they're willing to try anything. And this is where coming back to finding the professionals that will listen to you, that understand the problem, and then help to resolve in finding a solution for that. Not just what they can or can't do, but directing people into what it is that they want and need.
Yeah, and probably finding, I don't know what it's like for you and I guess the professionals around you, but as a personal trainer, I always say to people, if you have a personal trainer, like, I always encourage people to ask questions. Like, asking questions is the best thing you can do. Be curious.
Yeah.
Especially when it comes to personal training, moving your body, all that sort of stuff. And if your personal trainer has answers for everything, it's probably not the best thing. Like, quite often I'll say, I don't know, because I don't. Like, you can't know everything. And like, I think that's a good thing, especially within the fitness industry, when you've got somebody saying, I don't know, I'll find out, or go see this person, they might know. Do you find that as well?
Yeah, absolutely. Someone that is curious about you, as opposed to being really rigid in what they're offering, I think is a really important way of understanding the type of support you're going to get. And that's with any professional.
Yeah.
Western medicine, Chinese medicine, naturopath, PT, anywhere that you're looking for support, it's about a team and developing that team and how well that team works together. And if they don't want to be a team player, maybe it's time for you to be that, I guess, trying to advocate for yourself and find other players that will really support you.
Just sucks that those people pushing that one thing get a lot of airtime on social media, because it's different and it's very precise and it gives one answer.
It can help significantly. I'm not saying that, what they're offering isn't going to help. It's going to help a proportion of people, and that's why they gain that traction. And it will be people that are like, yes, this is what I was looking for, which is so wonderful. It's just, don't compare yourself to them if it's not the answer for you. There is a different answer somewhere.
If somebody come to you and they want to improve their health and wellness, and you could only get them to work on one thing, exercise, nutrition or sleep, and they can only do one, where should they start and why?
So you need to peel that back and work out from them what their symptoms are, and then go from there. And what they are capable of doing. So this is where asking a lot of questions. If you're eating and you have a big meal and then you can't sleep, is it the food or is it the sleep? If you're not sleeping at night and you might get an hour or two and then you set an alarm because you need to exercise at 5 o'clock, potentially it's the sleep that needs to take priority and not the exercise. Does that make sense?
Yeah, 100%.
Yeah. So it really depends on, again, this individual approach of what your symptoms are, what is happening to cause, all of those concerns, and then peeling back to find the root cause of that and starting there, treating the symptoms at the same time. So in Chinese medicine, we call it roots and branches. So roots is like the foundational reason that everything is going into dysfunction. So we want to support that, but at the same time, you still want symptomatic relief. And so we will treat the symptoms on top of that. Yeah.
Love that.
Yeah.
So you're creating a workout program with some other...
So a whole program, based on... we've started with polycystic ovarian syndrome, mostly because, I think with these types of conditions, people are looking for management techniques and understanding what it is that means for their body. So oftentimes people will look at the branches or the symptoms and, kind of, I guess, just work with that. And once those symptoms are gone, then they're okay with that. But those types of conditions like polycystic ovarian syndrome can really significantly impact long term. And I think, this is where we're coming back to trying to bring back preventative healthcare as an option to really understand what your risk factors are, to then work out how you can potentially alter the trajectory that you're on in terms of your health. So we're starting with PCOS because it's something that, there's been a new paper that's come out in 2023 that not every medical profession is over at the moment, because it takes time for people to gather that information, store it, and then be able to replicate that with their patients. But it was significant enough that it increased lifestyle factors and understanding the potential risk factors and opening up the criteria of what PCOS meant to the individual. And part of that is looking at the way that exercise can have an impact on the body for someone that has polycystic ovarian syndrome.
So to help manage it or prevent it?
So this is an interesting one as well. So the criteria, there's a set of criteria for polycystic ovarian syndrome, and that is what they call the morphology of the ovary. So how many follicles, if someone does an ultrasound, are there in the follicle when they do the imaging? So if there's a lot of follicles in there, that means that there's certain hormones that are having an impact on the way that the follicles are developing. And when they're all competing, it has an impact on the way that they ovulate. And so morphology is a component. If they've got irregular cycles, that is a component. And then if they've got androgen issues, and androgens are things like testosterone, but also different androgens, I guess if we just call it testosterone, but different hormones that are, converted in the kidneys and things can also have an impact. The adrenals on top of the kidneys. And you can do blood tests to see if they have an impact as well. And obviously, if you've got androgen, like high testosterone, then that is going to have an effect on the way your other hormones work. So people call it a hormonal condition, but hormones also have a significant impact on the way that your body looks at storing weight, insulin resistance, and all of those things as well. And so whatever the foundation for their criteria is, if someone is able to adjust that and they fall out of the criteria, technically they don't have PCOS anymore. So it's a hard one to answer, but potentially they can do things that means that they fall outside of the criteria. Yeah.
So when it comes to exercise, what should people be thinking about then?
So when it comes to exercise with PCOS, then the biggest thing that the research is looking at is the metabolic function of PCOS as well, which usually in correlation with hormone, and it is an extremely complex situation. So actually what we're doing is just looking at one component, which is managing blood sugar levels and insulin resistance, no matter the size, because even if someone has what they call lean PCOS, which is a horrible term, but the term that is used at the moment, compared to somebody that has, I guess, larger metabolic concerns, foundationally it's still the insulin and blood sugar levels that we're looking at. And we know when we activate muscles, it can act as a sponge that can really help with that glucose and insulin productivity, and then that can have a significant influence on the way that they manage everything. So yeah, that's what we're looking at.
Yeah, I think it's very underestimated how important strength training is and how it should just be the fundamental. I always say this for everybody, like your foundation thing should be strength training. Like if you're building a pyramid, strength training is at the bottom. Like you've just got to start with that. Even if you don't enjoy it, it's just one of those things you have to do.
Just lift heavy stuff.
Yeah, to then go and enjoy the other things. It's sort of like, I don't know, the barrier to, doing your enjoyable things. You just got to get through that. Had one PT describe it as just getting through, like hiding the vegetables. You just got to get through the vegetables so you can eat the thing on the plate that you actually enjoy.
Yeah.
But you got to eat those vegetables before you have the dessert or whatever it is.
I love that analogy.
So it's like, I kind of wish a lot of health professionals would just prescribe, or if there was just a way to prescribe strength training. Like
I completely agree. Yeah. If you have that solution, please.
Yeah.
Because I think that is my biggest, I don't go to the gym all the time. When I do consistently, I love it, but it's usually when someone is guiding me through that and I know what to do. But if I was just to walk into a gym, even if I've done it before, there were certain things that they would kind of put in place, and so you knew what to do, but I don't know how to manage that. And I think the general population don't know either. So yeah, if you
Well, I guess that's like most of the reason why I do this podcast, to try and get people interested in improving their health and wellness. And like I call it True Form Podcast, to help people try and find their true form in the gym, but in real life. But I think it starts in the gym.
Yeah.
If you can start moving your body and get comfortable doing that, I think just everything else starts flowing a little bit easier after that.
It's intimidating walking into a gym. It's intimidating looking at these machines and not knowing where to start. And so the other side of that is, people, I know, especially for women, they're really big on doing everything themselves. And when all of a sudden you have to rely on somebody else, or you have to ask for that, it can be one of the barriers.
I don't think that's just women. I think guys are even more.
Yeah, no, I think you're right. Yeah.
In my experience, females are a lot lot more acceptable of like different things, where guys are like, nah, this is how I do it. Like, you're wrong. I don't know if it's just a guy trying to tell another guy what to do, especially in a macho place like a gym.
Possibly, yeah.
Yeah. Just, I guess, trying to break down that barrier of getting people in the gym. Like I said, like post-COVID, obviously numbers are very different before COVID, now after COVID, with gym memberships. I think it's floating around 18 to 20% of the population have a gym membership.
Yeah, wow.
Which is scary. And again, a lot of people out there running and all that sort of stuff, but again, strength training needs to be your base.
It has to be, yeah. And I'm just hoping this conversation comes up more and more with strength-based. Even though I'm starting with PCOS, there is a big correlation between PCOS and menopause and the way that we manage that, given this fluctuation in the different hormones and the protective value of estrogen and progesterone within women's bodies. And so both of them in particular are really specific to weight training and that progressive overload of weight training, not the 2 kilos of Pilates, which is still really important for, you know, all the other factors, cardiovascular and making sure that you're flexible and all the rest of it. But yeah, this conversation around what training actually means and is. And one of the things that is really significantly addressed in the guidelines for this paper that was released as well. So
yeah. And when we say weight training, a lot of females freak out because they're going to bulk up.
Yeah.
and
the opposite.
Yeah.
You tone and it will start to, you know, shrink that adipose tissue. And as you were saying before, it's not about the weight itself. It's about the muscle ratio.
Yeah. Making sure, it's the fitness industry's fault. We've sold looks and weight as a way to succeed. Like if you look this certain way, you're healthy. If you're this certain weight, you're healthy. And it's definitely the fitness industry's fault because it's easy to sell and make money from. So a lot of people have done it and now we're just conditioned and believe that. But I just wish people would just go, you know, I need to be healthy, so I need muscle mass.
Yeah, yeah. And as a female, it's a really hard one to shift as well.
Yeah.
Because again, it doesn't meet our instant gratification wants and needs. It is a long-term thing, and it's about, everyone bangs on about how it's just consistency. But consistency when it's slow like that is hard to maintain that motivation.
100%.
Yeah.
Yeah. And that's why you don't rely on motivation. Discipline.
That's exactly right. Yeah.
Motivation is just another emotion that'll come and go.
That's right.
Yeah.
Yep.
All right. Can I shoot you with... I'm pretty sure I've covered most of these questions.
Yeah.
We'll wrap up with these questions.
Sure.
Listen to questions. You can skip over them, just short answers, whatever you feel like is necessary. Trying to get this laptop in a decent position so I can see it and still talk to the microphone. So, is it normal for my period to change as I get older, even if I'm not near menopause?
It does depend on the age. It does depend on different... it depends on how different it's changing. If we're talking, you know, I guess a normal period cycle is normal, as in classified as irregular, is between day 25 to 26 and day 34, 35. If it's fluctuating within that, okay. If you're finding that you're not getting a period for 2 or 3 months, that is something to talk to somebody about. If you're only getting sort of 3 or 4 a year, basically. If you're experiencing really light bleeding and then really heavy bleeding, then that would also be something to consider. And that doesn't matter what age you're at. Yes, it might be that you're coming into menopause and those hormones are starting to change. And that can happen from kind of age 35. But there are also risk factors that, you know, can play a part in that as well. And so sometimes these don't present until we're older in our body as well. And definitely that might not mean testing hormones. That might mean having a look at other, you know, physiology that's happening. So going to see a GP, making sure that there's no imaging, or having regular pap smears and all those sorts of things need to be taken into context with that as well.
we could probably skip over this one.
What is it?
How can I tell if my hormones are out of balance?
Yeah, symptoms.
Yeah.
Yeah.
If you feel out of balance.
Yeah, well, it's symptoms. And I think, people shouldn't dismiss their symptoms. Like if things start to feel like it is becoming an impact in your day-to-day life, then talk to someone about it. If it's not inside a disease state, then maybe it's not a doctor that you would start to see. Maybe it is someone that focuses on women's health, whether that be a naturopath or a Chinese medicine practitioner or women's health physio, depending on the types of symptoms that they're getting, but not dismissing symptoms. Yeah.
I guess one way I would look at it from a PT lens is when people do get in that consistent routine and then they fall out of consistency and they feel off and it's like, I just need to work out to feel normal. It's because, not that your hormones are unbalanced, but you just feel unbalanced.
Yeah, yeah.
Because you're out of but as we just spoke about, exercising helps you regulates everything, keeps you healthy. So obviously if you stop exercising, you're going to feel out of balance. So again, it's just sort of those little things. I think everybody.
Yeah, agree. Yeah, what has changed?
Yeah,
and
exactly.
This comes back to data.
Yeah, but also work could just get stressful as well, and things are going to change. So yeah, I've come off the pill. What should I be doing to support my body? Sorry, that's very vague.
No. It's actually a really great question. Okay. Because we know that the pill does disrupt certain nutrients in the body.
Okay.
And so there's a few factors with this. First of all, it depends on the age that they went on the pill and what symptoms they might be experiencing once they've stopped the pill and what they're wanting to achieve. So if they've stopped the pill because they want to fall pregnant, preconception care is very important. It's not just about trying to fall pregnant. It's about making sure that you've got the nutrients sufficient once you fall pregnant, supporting your body through pregnancy, and then having healthy birth outcomes and being able to then support you and your baby post-birth. So it is best to talk to somebody as soon as you decide that you think you want to start having children, to make sure that you're in the best shape for this marathon that they are about to run. It's not, a lot of times people will just talk about falling pregnant, and that is just the very first step on a long line of steps. So if they were trying to fall pregnant, then that would be something to consider. If they're finding that symptoms have started once they've stopped the pill, because we know that that might have a change in their period, depending on if they've been forcing a bleed or if all of a sudden it was regulating the lining in the uterus that then starts to bleed out. So heavier cycle. And if you started the pill early, why you started the pill, so if it was for symptomatic relief, that can be an indicator of the way that when we spoke about hormones start from the brain, that pathway needs to form between the brain and the ovaries. And so if that pathway was trying to form and then you take the pill, it can prevent that from fully functioning. And so when you stop the pill, it's back at the age that you were potentially. Again, this isn't something that happens with everyone, but sometimes we can find that there will be that level of dysregulation until such a point that it starts to kind of find its flow. Yeah.
Okay. Interesting. Good question.
Great question.
Yeah. Can acupuncture actually help with fertility? We spoke about this before. So what is acupuncture? I've never had it.
Yeah, okay. So acupuncture is... Look, I mean, it was developed, they talk about 2,000 years ago, but 2,000 years to really develop this microsystem in the body. So acupuncture points are little points on what we call meridians. So these like highways that form through the body. Basic general Chinese medicine look at 12 meridians, and then on each meridian it attaches to a specific organ. And not that we talk about so sometimes when people go and see a Chinese medicine practitioner and they say their liver is in dysfunction, we're not saying that the actual physical organ of the liver, we're saying that there is a pattern around what that dysfunction might look like. And then we would use those acupuncture points along that meridian to help support treatment. So for example, if we're talking about the liver from a Chinese medicine perspective is in charge of the way that blood flows through the body. It's what carries hormones through our body, and patterns that we can see when it's in dysregulation are things like anger, sometimes shortness of breath, really short fuse, pain. And so we would use acupuncture to then help support that meridian and try and create that balance and flow back through the body to then release some of those symptoms.
So in a way, it would help with fertility.
Yes. So we use it in fertility, one, for blood flow, because we're talking about hormones, and hormones are what flow through the blood. Two, from a potential neurological level, because as we said, it starts from the brain that triggers these hormones into the bloodstream. So we need to, make sure that those pathways are working as effectively as it can. We know that stress is a part of trying to fall pregnant often if it's not happening soon enough, or if someone is in a stressful state, not necessarily that it's going to prevent them from falling pregnant, because we know that people have babies in war zones. But that it can have an impact on, other areas of the body as well. So certainly stress management. Again, it can also help with digestive changes, which we know has an impact on the way that the body absorbs certain nutrients, and that is also important for fertility as well, for both men and women. So this is the way that we would use that in combination, whether they want to start trying naturally and they see an acupuncture and Chinese medicine person to help support that initial phase, or if they're going through IVF or any other assisted reproductive therapies and want to, help support those ways as well. Yeah.
And can you just touch on the difference between dry needling and acupuncture?
So dry needling is actually a technique of acupuncture and Chinese medicine.
Oh, there you go.
But they call it dry needling, which is technically where you insert a needle into the muscle, signal the trigger point within that muscle to cause a contraction and then a release. And so it can be extremely helpful when physios and chiros and, other modalities that are really aware of the physiology in the body, because that's really important to know what you're needling into in the body.
Definitely.
But it's not regulated the way that acupuncture is. And it is often a much shorter course, so it might be a weekend course, as opposed to a Chinese medicine practitioner who's been to uni for 4 or 5 years. So if it's anybody stepping outside dry needling, their modality might be if they are calling dry needling for fertility or dry needling for stress relief. What we're really wanting is dry needling to help cause a contraction and release of a muscle, which can be extremely effective. And I don't do that type of needling because I don't see musculoskeletal conditions. But if someone comes in with that, then I would be more than happy to refer them to someone who does dry needling. An acupuncturist usually has more awareness around, if there is pain, what other things might be helping to support the reduction of that pain. So it's not just about that muscle in particular, but why that muscle is being contracted the way that it is. Is there emotions around that muscle? Is there other factors going on within their lifestyle that's affecting the muscle, muscle support? So dry needling has its place, but acupuncture uses all the modalities that we know that can have an effect on the body, including not just that symptomatic change of the muscle, but also the holistic view as to why that muscle might be out of optimal function.
Nice. Where are we? What are some natural ways to reduce PMS and cramps?
So there are a few supplements that can potentially reduce it, which, again, because we're talking about dosage and being really specific, I would recommend talking to a naturopath or a Chinese medicine practitioner about. Because I don't want to name them and then people think that it might be a general blanket statement and they go to the chemist and purchase them.
Yep.
And depending on when they're experiencing the cramps, when they're experiencing those other symptoms and what else is happening around, would then create that path for what treatment plan might be best for them. But there are, even acupuncture can significantly help support both a regular cycle and also the quality of bleeding during a period.
So yes, like you said, yes, take some supplements or acupuncture to reduce the symptoms, but also look at what's causing
the reason why.
Yeah.
And I guess an example of this is a lot of supplements on the market include an ingredient called Vitex, which is chaste tree, and that is used quite significantly as a hormone regulator. However, it does have an impact on the way that estrogen and progesterone and luteinizing hormone, which is a hormone that initiates ovulation, all talk to each other. And so if you have a condition where you've got high estrogen in your body, and then you're adding a supplement that also initiates or promotes increased estrogen, this is an example of how a supplement is not going to serve you, and in fact probably have an adverse effect. So, even just things that have a blanket statement like that can be really significant for someone who might have an adverse effect on that supplement, even though it seems, it's got all the labels, it's TGA approved, everybody is taking it. But as the individual, it might not be right for you.
So, yes, there are, but still seek some advice.
Yeah.
And figure it out.
Yeah.
What's going to work.
Even if it's, it doesn't mean that you have to have a treatment plan with someone. You can just come in and talk to them about these questions. You've heard that this might work. Will it work? Can I take this? It might be yes, and it will be fine. And often, I've got people that will be like, well, I just bought these hormones off the internet and they're helping. Great. Do they continue to help, or is it a short-term thing? After 3 months, do you then notice different symptoms? So, just being aware, but ask questions. It doesn't have to be this daunting, massive treatment plan when you go and talk to someone.
I'm in my 30s. I'm in my late 30s. What should I be doing now to prepare for a healthy menopause?
Start to incorporate weight training. Have a look at, diet and what you're putting in your body. If there are any concerns with your cycle, talk to somebody about what that looks like. They can all potentially be things that will support how their menopausal journey is, because not everyone is going to experience significant symptoms with menopause. And there are quite a lot of women that just their period stops and they continue with life, and that's just what happened. Once you hit 40, it I think is really important that people start to understand what their particular risk factors are. So understanding that risk factors that can be preventative per se are things like understanding your osteoporosis risk, understanding your cardiovascular risk, and understanding that kind of dementia brain function as you age as well. And that might be familial changes, so seeing how your family responded to their menopausal journey. And you can get things like a DEXA scan, which is a bone density scan, to have a look at where your bones are at which will then have an influence on what kind of activity and if you need to significantly increase that if your bone density is lower than it should be for your age. So, yeah.
Weight train.
Weight train.
That's all I took from that.
Yeah.
All right, 2 more. Do you have any tips for managing anxiety or poor sleep during premenopause?
Yes. Again, it depends on other symptoms around the anxiety. From a Chinese medicine perspective in particular, we find there are 2 pathways that we look at. There's probably more, but these are the 2 most common ones. One is if you've got really heavy period and you're losing that blood and you're not topping it up, if that blood from a Chinese medicine perspective is not nourishing the body, it's not nourishing the mind, it's not supporting the heart, then that can have an impact on both anxiety and sleep. We do need energy to sleep as well. So if someone just is trying to they're so exhausted and they're trying to get themselves more exhausted to get to sleep and they're still not, that can have an impact. You need to have some kind of energy to be able to sleep as well. The other side of it is we know that heat can have an impact on that as well. So if you're someone that's experiencing hot flushes, things like red wine, spicy food, coffee can have an increase in that internal heat that you're experiencing. And it's almost like if you put a pot of water on a stove and you turn the heat on and you see it kind of agitate, that's almost what people can kind of feel in that premenstrual phase before they get their period, or even just during those perimenopausal changes. And so then it would be looking at ways to minimize the heat. Why is the heat there? There are different herbs, acupuncture, supplements and things that can help support it. So I guess, another way of someone coming in with a condition and 2 very different treatment approaches.
Yeah. Last one, and it's for you. What's one thing Dr. Suzi wishes every woman knew about their cycle? So one thing everybody should know about their cycle.
What is one thing everyone should know about? I guess how they feel within their cycle, understanding that there are changes and really understanding how that expresses in their body. Because it's from there that you will then know if anything starts to change outside of it, to know when to start looking and being really observant on that these things are starting to change. Yeah.
Nice. Last one, I promise. This is my question.
Yeah, great.
If you had control over every single person, they had to do one thing, you got to tell them to do one thing every single day, just one thing. It could be to do with women's health, anything. Doesn't matter. But every single person had to do that one thing. What would you get them to do?
I don't know. Again, because I think it's a blanket.
If you had to blanket everybody with one thing.
Probably eat breakfast. Yeah. Start the fueling component that morning.
Love that. Perfect. Just before we go, one thing I've noted, again, this is a guy talking about women's health.
I know, we could talk about this all day.
But I think putting yourself first, I think a lot of females out there just don't put themselves first, especially when mothers, post-pregnancy. Like you were just saying that you need energy to sleep. A lot of mothers, again, it just comes back to us being animals and looking after this new animal we've just created.
Totally.
Definitely. But you need to look after yourself first and making sure you're eating the right food, exercising, getting enough sleep, all that sort of stuff allows you to be a better person so you can help more people or help that child or, just have a better quality life. So looking after yourself first matters a lot. Taking that time to look after you isn't selfish. It's beneficial, not only to you, but the whole world around you.
Yeah.
Where can people find more information about you, contact you, work with you?
Social media is usually Instagram's usually the best way. There's a link tree. They can book online or come and see. I'm in a few locations at the moment. DM me on social media as well. Happy to answer questions. It can only ever be general advice. But I think, if it's not me, then looking for somebody in their team that they want to create that is really specific and around women's health, because they are the ones that are looking at the most common or the newest literature. They're the ones that are curious about you and women's health. And they're the ones that generally want to keep up to date with all of that information. So they will be the most helpful. And, even if that means, if they can't find anyone, please reach out and we'll find someone in their area, or even just understand where to start, because there is just so much out there. But I think just on your final comment there about, putting yourself first, completely understand when it's different. If you're a sole parent, you've got, it's hard to rely on anybody. But one thing that I heard a mum, she was a menopause GP the other day, was talking about how she wanted her children to see how important it was for her to have her own autonomy as well, so that when they grow up, they know that it's normal.
100%.
And I thought that was a really beautiful way of looking at supporting you, teaches your children that they can support themselves. They don't have to give to their children when they have them, or anybody else that they need to. So, I thought that was
that's some
significant.
Good generational change right there.
Absolutely, yeah.
Awesome. Suzi, thanks for coming on the podcast.
Oh, thank you so much.
If I was to coach you for the next 30 days on your habits, your nutrition, your sleep, your fitness, do you think you'd feel like a new person? I see this all the time. People getting excited after watching a YouTube video, listening to a podcast, or downloading a PDF. They have all this good information, but then they fail. A, because they don't know how to implement that information, or B, they haven't got anybody holding them accountable to implement that information in their day-to-day life. And that is exactly why I created the 30-day reset. So we can work together every single day for the next 30 days. I'm going to show you how to build a rock-solid morning routine. Make a workout routine that fits into your life, that works for you instead of against you. How to eat for your goals without tracking calories. We're going to work on the fun stuff, stress management, sleep, and then we're going to build a strong mindset so these habits last well after the 30 days is done. I am obviously excited to help you in this next 30 days. So let's get started. Stop watching the YouTube videos, podcasts, all that sort of stuff, and let's just start making real change that lasts for the next 30 days and beyond. Okay, stop waiting. Let's get into it. Let's go.